If you're studying for the INBDE, I highly recommend INBDE Bootcamp, an all-in-one study resource that will help you pass your exam. Use coupon code MENTALDENTAL for 10% off. Hey everyone, Dr. Ryan here, and welcome back to our oral diagnosis series. Let's continue with developmental anomalies involving the lymphoid tissue. That's tissue that supports the immune system, where lymphocytes and other immune cells can be found. So first, we'll start with the oral lymphoepithelial cyst. An oral lymphoepithelial cyst is a small, usually less than 1 centimeter in diameter, whitish, yellow, submucosal nodule. It's usually firm, about 75% of the time, but it can be soft as well, about 25% of the time. The tongue is the most common site for oral lymphoepithelial cysts, specifically the ventral surface and the lateral borders of the tongue where the lymphoid tissue is. The floor of the mouth is the second most common site, followed by the palatine tonsils. This lesion is thought to be caused by entrapment of epithelium within lymphoid tissue of the oral mucosa during embryonic development, also called embryogenesis. Basically, when the crypt or pocket of a tonsil gets plugged with extra epithelium, this cyst forms. It's painless and asymptomatic, which usually means the patient doesn't notice it until a doctor points it out to them. And so it doesn't typically require any treatment. A branchial cleft cyst is basically a neck version of the last slide. In other words, a cervical lymphoepithelial cyst. So let me explain that a little bit more. The pharyngeal arches, which can also be referred to as the branchial arches, are responsible for embryonic development of all the head and neck structures. And there are clefts between these pharyngeal arches. The first pharyngeal cleft becomes the outer ear opening, while the second, third, and fourth clefts contribute to a temporary internal space called the cervical sinus. Now, if that space doesn't completely close up or obliterate, it can leave behind a branchial cleft cyst. Like all cysts, it's lined by an epithelium. Remember, all cysts have an epithelial lining by definition. Generally speaking, the oral lymphoepithelial cyst is epithelium trapped in a tonsil, which is intraoral lymphoid tissue, while the branchial cleft cyst is epithelium trapped in a cervical lymph node, which is an example of extraoral lymphoid tissue. And that's a really important distinction and connection to make between this one and the last slide. When it comes to histology, though, branchial cleft cysts and oral lymphoepithelial cysts share identical microscopic features. These lateral neck swellings or bumps are fluctuant, which means they're movable and compressible, and non-tender. They are also the most common congenital neck mass. These lateral cervical cysts also occur just anterior to or along the anterior border of the sternocleidomastoid muscle. It's a very specific location, and keep this in mind when we get to 2 slides from now. This will be a very important identifying feature. Before we continue, I have to tell you about this incredible AI study tool that will help quiz you on what you're learning in this video, and it's called Wisdolia. It'll give you an outline, flashcards, and even case scenario questions customized from this video. And as you answer the questions, you'll get personalized feedback to tell you exactly what you got right, what you got wrong, and why. You can find the Wisdolia link in the description below. Now, back to the video. Next is the oral lymphangioma. Despite its name ending in oma, which is typically indicative of a tumor, This condition is not technically a tumor. Lymphangiomas are benign developmental anomalies characterized by an abnormal hyperplasia of lymphatic vessels, the thin tubes that carry the lymphatic fluid throughout the body. These are usually congenital, and most cases occur during infancy before 2 years of age. Intraoral lymphangiomas most commonly appear on the dorsum of the tongue, but can also appear on the lips, buccal mucosa, soft palate, and floor of the mouth. This congenital focal proliferation of lymph vessels causes groups of elevated nodules that range from yellow to pink to red to purple in color. And the darker colors are due to secondary hemorrhage that occurs within the nodules or vesicles. And last is the cystic hygroma. Just like the branchial cleft cyst is a neck version of the oral lymphoepithelial cyst, the cystic hygroma is basically the neck version of the oral lymphangioma. In fact, cystic hygromas are the most common subtype of lymphangiomas, appearing at birth or in early infancy. A cystic hygroma, or cystic lymphangioma we could call it, is a fluid-filled bump that, just like the branchial cleft cyst, is also fluctuant and non-tender. It's caused by a blockage in the lymphatic system pathway during embryonic development. So you might be asking, this looks like the same as the branchial cleft cyst. It's a lateral neck swelling, fluctuant and non-tender, and it appears usually early on in age. So what's really the distinction here? Here it comes. You ready? This one is located posterior to the sternocleidomastoid muscle. So the branchial cleft cyst usually originates in front of this muscle, while the cystic hygroma usually originates behind this muscle. And that's how you can tell the difference. That's it for this video lecture. Thank you so much for watching. I genuinely appreciate it. I'd also really appreciate if you consider clicking that like button below this video, subscribing to the channel if you have not already, sharing this video with your friends, and leaving a comment below letting me know what you thought. All of those things can really help to grow the channel. If you want to go above and beyond supporting me and what I do here, please check out the Patreon page linked below. If you want to join there, you'll get access to exclusive practice questions, exclusive study guides, a Discord server, and so much more. And if you see at the end of my videos, I have an end credits screen, and all of those names there are the names of my amazing Patreon supporters that I'm honored to have. Thank you again for watching, and I'll see you in the next video.